So how many people are actually on patrol?
Right now?
Yeah.
Friday night, not too many, because it's like sort of half staffed with pro patrollers, half with volley patrollers. But tomorrow, it'll be mostly volunteer patrollers all day and all night. And we'll probably have 20 of us.
Oh, wow.
You know?
Big group.
Yeah, big group. A lot of white crosses on the hill. And we don't just ski. You know, we have to like bamboo stuff and mark hazardous terrain and help people out and say hi and put the tower pads up. And we do get first turns in the morning, which is nice. So we do have to open the mountain, which is fun. But you know, we just ski around, and sometimes you just like right in front of a bad tumble and you're like right there. And sometimes the lifty says, you know, ski patrol, there's someone at Tower 4 that's hurt. So we get to ski around and just help people. It's really fun. It's a lot of PR stuff too, just like saying hi, talking to kids. I love just standing in the lift line and like talking to kids. And I'm just like, hey, I'm like, you know, high-fiving them, like patting them on the helmet, like, all right, like rip it up. I'm the chairlift with folks, it's super fun. You know, my catchphrase is like, nice to meet you, but I hope I don't see you again. It's old.
So how long does it take you, let's say, what's the farthest like commute from here to get to an injured patient in the ski resort?
That's good. Minutes. There are always patrollers at the top of the hill. So each of the top of the Central Express and top of 6060, those are the two main lifts here that are open at night, and then Silver Fir. So there has to be a patroller at the top of Express always. That's the highest point at Central, and so from there you can get almost anywhere. Almost anywhere. So, and then also if the lift stops for some reason, becomes non-operational, we're also trained to do chair evacuations. So I've done 2 chair evacuations in 7 years. And so we have to have people at the top of the hill because all the equipment is at the top of the hill. And it's actually it's like simple rigging. We have to shoot lines over, pull the ropes over. It's pretty neat with the harnesses on, blade devices.
Yeah. Do you need to do that tonight?
Yeah, if you guys want to go, you know. No. Yeah.
How did you get started as an EMT? Like with a physicist background?
Yeah. I think like a lot of you guys, you know, at some point in my life, maybe not like, I don't know how you guys got into medicine, but I just enjoy helping people, whether it's teaching or whether it's like medicine. And so I did way back in the day, you know, first aid and WFA. And I was like, oh, this is neat. And I led more backpacking trips for a school I worked at. And then I got WFR, the Wilderness First Responder, like 9-day course, whatever it is. But when I tasted that, I was like, ooh, I like this stuff. I'm not like drawn to trauma, but I was like, oh, this is really cool stuff. It's like very applicable in everyday life circumstances. So then I just sought my wilderness EMT, and my school paid for that. So I got wilderness EMT, and then I just kept it up. And then King County endorses me, like Miles. So we keep our certification through King County Sheriff. Does that answer your question?
Yeah.
Yeah. And, we use it. I don't think there's, like, I've done everything I can do as an EMT. Like, I can't think of many more situations in which I haven't used that skill yet. Right? I've from like skulls that are punctured and people that are barely alive to like giving EpiPens to doing CPR to like femurs and ankles and knees and punctures and lacerations. And I can't think of anything I haven't dealt with. I'm sure there are. I know, just like Miles, you know, you're in it long enough, you just kind of see stuff. Not that I'm really good at any of that, but I've dealt with it. Broken bones are actually in like lower leg, but like tweaked knees and tweaked ankles and tib fib fractures are pretty common here, especially early season. So those are pretty straightforward to deal with. So we do a lot of those, like wrists and fingers sticking like that way, and like, you know, shoulders that are like, that's not. Pretty sure your clavicle's not supposed to be in 3 pieces.
So what about the physicians who do come help you out? What experience do they have? Do they have?
Awesome.
Okay.
I love having a doc up here because, you know, EMT, I can't do that much. And actually, I can't practice my EMT skills here. I have to practice my OEC skills, so that's outdoor emergency care, that's national ski patrol standard of care. So if I go on a mission like across the street with SMR, Seattle Mountain Rescue, I'm an EMT, but here on the hill I have to practice my OAC skills, and they're parallel. They're almost the same. There's a couple little things that like I can't do. There's some gray area, you know. So I forget the question now.
Yeah, just what sort of physicians? Are they all like emergency room physicians,
Sorry,
or like, or can it be any physician that just has like
Right.
some ski patrol experience?
No, they're like doctors that like to ski. They're like docs that just like don't mind volunteering their time and they get a pass. They're so rad.
So everybody here can do that
Yeah.
at some point.
You know, passing off a patient to the doc, and I just help the doc, and it's really fun because, like I was saying, I can only do so much. But then it's like, hey doc, and they just kind of jump right in. We work as a team, and it's interesting because like they sometimes, especially the residents, aren't as comfortable with like dealing with the patient in the moment of like when it's first happening, like when we get walk-ins. They actually let us just like handle the assessment and figure out what's going on, and then whenever we ask them over, they kind of come over, which is, you know, all the time, and then they help us out and work as a team. And they, most of the time, if it's something serious, it's like, okay, ambulance gone. I mean, patients don't linger here. It's kind of like a stop and go. Sometimes it goes right from the hill to the ambulance. We bypass the first aid zone.
So are they mostly hanging out here, or are they doing the same sort of stuff, skiing around the same?
Oh, they're on the hill skiing, yeah. They wear one of these. Good choice.
Hello.
So, you can wear a jacket that's sometimes not, they actually have white crosses on the back, but a jacket just like this. Yeah, kind of like a vest like Joyce has on.
Thanks for that.
Yeah. So, equipment, alright. Yeah, you know what an ice machine is. You know, pretty standard like blood pressure cuffs, and when we're not busy, we actually go through and like wipe everything down, make everything sterile. But we have adult size and peds blood pressure cuffs, like all these drawers. We have our own like laundry here, and you know, everything's clean. We clean it like continuously. The fun stuff. So yeah, everything's labeled. Using a cravat, we probably use like, these are the small dinky ones, I don't like to use those, but the bigger ones, you know, we go through so many cravats, like it's amazing what you can do. A sling and a swath, and we can practice this tonight. Putting a sling and a swath on people for all kind of injuries, basically stabilize, you know, any kind of arm, shoulder injury. Padding, bandages. So, leg splint, any kind of leg injury, basically we like use this and you just cut it. Like if you have a kid, cut it shorter. You know, a short person, you cut it shorter. And it's amazing like how simple it is. So, sometimes when it's slow, we'll just make a ton of these, especially when you have like first year students or something like that. But, you know, for lower leg injuries that come in, again, like I was saying, there's not much we can do for a lot of the injuries besides like make sure it's not getting worse. So, you know, this, you can imagine, you want to hop up there? One of you guys want to hop up in the bed? Sit there? Yeah, sure.
Nope, I've been hurt.
There you go. Sorry. So,
It's my left leg.
so you know, let's say, I'm not sure what the injury would be here, let's say, you know, his knee, like tweaked his knee. Maybe he had like even dislocated kneecap, you know, whatever. We'd probably take the shoe off and...
Take my shoes off.
No, you don't have to, don't worry about it. I'm just saying. Yeah, there you go. Oh, that's good. You comfortable, sir?
Yes.
I'd have gloves on, of course. But
And Matt, can you speak to the ski boot or the
yeah,
the
that's
snowboarding
Yeah, actually, who
boot?
has ski boot on? You have a ski boot? You guys are all snowboarders?
Can you be a snowboarder, ski patroller?
Yeah, we do have snowboarders. Yeah, we do have snowboarder ski patrollers.
Can they
It's kind
do
of
the
funny to say.
toboggan?
So what's that?
Can they do the toboggan? on
Yeah,
the snowboard?
totally.
That's impressive.
Yeah, totally. Yeah, it is impressive. Yeah, yeah. Actually, like we can even practice with one of your, because you have actual boots on. It'd be kind of fun to practice with a snowboarder boot.
Yeah.
So you could.
Sorry.
Yeah.
Here, make it more comfortable too. Okay, cool. Miles, you can help too if you want.
Sure.
Someone else can help. Whatever. So you get the materials ready, and if this will make it as realistic as possible. You're all wet. Right. So we'd probably have the patient like that first of all. Like let's just assume it's some kind of injury to the knee, and we'd actually take off this boot first because I want to figure out how all boots are different, right? So I'd actually take this boot off first, the non-injured leg, so I know what I'm doing, right? Very nice. So let's just assume I did that, and then what you do is you get. I'll have you guys. Well, whoever's not holding a camera, I'll have you guys help. So you'll stay on that side, and what you're going to do is you're going to take her clothing or pant leg, and you're just going to wrap it up nice and tight like this.
Okay.
So basically you're stabilizing above and below just by holding it. You feel how it's tight and gripping?
Yeah.
So don't be afraid and just really roll up and grip it. You try not to move the knee, of course. Then you're going to do like a little clamshell thing here. You're going to get in like this, all right? And you're going to come in and you're going to hold her leg like that. So I'm kind of like clamshelling it like this.
Right.
Okay.
While he's pulling
Yep.
at the same time.
Exactly.
So you, alright, how about I go in first and then?
Yeah. Then you have to kind of coordinate. Maybe you go over him or something like that.
Yeah, there you go.
Yeah, teamwork.
So that way, like one person's stabilizing above and below the injury, and the other person's just holding the leg, so I can take the boot off easily, right? You guys are doing a great job.
Now, do you ever end up cutting clothing, or do you do
Yeah.
everything you can not to cut it off, or it just depends on the emergency?
I just ask the patient.
How much do you like your jacket?
Yeah. So
Because Gore-Tex gets pretty expensive.
it does.
Ski
So
ski
I've only
pants.
cut clothing a couple of times, and the couple of times I've cut it, it was either already cut, or they were like, I don't care, like, do what you gotta do. Right? They was like, I don't care. So one was a guy had a brand new pair of sweet Arc'teryx pants like last year, and but he sliced like really had a really bad slice. Like I could see the bone, and he was bleeding really bad. And his pant leg was just soaked. And he actually he skied in, kind of hobbled in. And I was like, why don't you have a seat? And I'm gonna cut these, okay? He's like, yes. Okay. So that took a while to stop the bleeding. Actually, it was like I said to him, we need to go. Like you need to go get stitches. So I put a lot of padding, put a lot of pressure on. And after 10 minutes, it barely stopped. So see, I should have taken the other one off. How does this thing work?
I don't know
Oh.
actually because these are rental boots.
So I always ask the patient, is there something funny about your boot, something I should know about? How do I get it off? Is there anything strange? Because I've seen a lot of boots, but there's always new technology and such. Okay, and you're going to hold nice and tight with a clamshell. All right, and I'll look at the patient and say, okay, like, I want to take off your boot on 3, nice and smooth, okay? 1, 2, 3. See, these guys can do it. Hold nice and steady.
She
And
didn't
then-
even scream.
Ta-da! And the boot's off. And now, yeah, you can let go. And he would hold. And I'll get this out of the way. And this gets fun. So you're going to take the pillow out. So you're going to take this.
Yeah.
Okay. And do you think that would that fit on her leg? Let's see, measure up on. You want to go all the way up to the crotch.
Should we cut it?
Yeah, so we'd probably cut it. So here, you and someone else can measure. Now, would we measure on the leg that's injured or the other leg?
The other one.
Yeah, so measure on the other side.
What should they be thinking about in terms of now that they've got the boot off and they're looking at the foot? What,
Sure.
What do you guys
yeah.
think they should be checking for or be concerned about?
Can you guys find a repeat pulse there?
So then,
Would we tickle her?
Change the sensation and this thing.
Yeah, so CMS, right? Circulation sensation. Yeah, can you wiggle your toes?
Great.
Great. Can you push down like a gas pedal? Can you pull up? Those are two things I always do. Okay. And then if you can, I can never find like little pulses. So if you can, go for it. I don't. You mind? I always.
Yeah, take the sock off. Gotta get that skin level.
Take the sock off.
Yeah, right? You gotta get the skin
You
level.
want some gloves?
Like first years, man. Shoot. God. I think you feel
I usually
Door
go. Yeah,
salad.
I usually put like 2 to 3 fingers along the.
Is it hard? Hold on.
Push your tibialis.
So at that point,
Check for 2 pulses. You can't find either of the pulses for whatever reason. Her foot's cold. She just has poor circulation normally. What else can you do to check for circulation?
Cap refill.
Yeah, you just do cap refills. You just push on the side,
Yep.
blanch it, and watch how quickly it returns.
Done.
Or just push on the toe, same thing.
You might always stand on your own.
Part of being a med student.
Right, but like Matt's saying, right, he's going to get both boots off, right, so he can compare extremity to extremity.
Yeah. And that's so. I'm glad Miles mentioned that. Like you gotta look. Right? Whenever you look for the symmetry, and that tells a lot. So okay, so cool. You guys aren't done yet. So he's ready to lift up.
Yeah.
Okay, we could probably get someone else if we had extra hands. We get someone else like lift the leg and just.
We got some extra.
What we're gonna do is we're gonna pull this. He's gonna lift up.
Do you want padding?
We're gonna pull the pillow out. Yeah, and then we're gonna figure out how much padding we need. So I have that padding over there. This is gonna go under the leg. We want some padding, so I roll that padding up and put it like underneath the knee.
Like this.
Does that make sense? You have more padding here if we need it. Maybe you want to pad like the foot, so. Yeah, how do you go like that? You get creative here. It doesn't always look pretty, but it has to work. So maybe that's what it is. Alright, hold that.
Count of 3, 2, 3.
Maybe you already said this, but this padding looks a lot like the stuff you put under carpets.
Yeah! It's cheap.
Cheap.
Is that working? How's that?
Good job, team.
Yeah.
How's the buddy feel?
Sorry.
I like the buddy.
It's over here.
Oh, okay.
I'm thinking of a name.
So then, we'd ask the patient. We'd definitely use more padding under here because, like, under the spots, we want to help her rest her leg essentially. But I would always say, okay, does that feel better?
Lift on 3.
Do you want it?
3.
Do you want more padding under your knee?
Actually,
It's too much, right?
Too much underneath my ankle.
Which one for ankle? Okay.
what about that?
That feels good.
We'd get a bag of ice or snow. We'd put it right over, right? The injury, probably contusion. Just we don't want to reduce swelling if possible. And then we taper. Right? And with this, I would tape right over the pants even. So you guys would help, and we'd go like this, being careful of the knee. And then I'd probably get you guys to lift on 3. 1, 2, 3, lift. And then you guys a little bit. Go underneath. So go probably above and below, right? So then right here, you guys want to do it? Go for it.
So right now we're going step by step.
Yeah.
It's going pretty slow.
Yeah.
But how quickly do you usually do this?
I mean faster, but we're also so usually by the time we're in the first aid room, there's like 2 patrollers, so you're
I
working
feel like that
together.
one is not.
We'd be getting her blood pressure. So one person will be getting like blood pressure and vitals, asking her questions. I'll show you the forms we have to fill out. We have to fill out 3 pieces of paper for every patient, minimum. So I'll show you the forms. They take a while. So we have plenty of time. If it's not life-threatening, we have lots of time. Before that though, we need to make sure we have the stuff in motion that she's gonna get out of here. Who are you with? Can they drive? Where's the car? Can you call them? Right, we want to like get that moving. We don't want you sitting here all night long. We want like your friends get in the car. You can hang out and have a beer. Great, just go. You know, it's like, but seriously, it's like go be someone else's problem. We're not trying to be like rude or mean. It's just like you need to go to the hospital or go home, but you can't stay here, so to speak. Right? We want you to like, because we always say, regardless of the injury, you need to seek definitive care. Right? You need to go see a doctor. That's what we recommend.
And they're taking up a bed the longer they stay here too, right?
Yeah, and sometimes it's like I said, like early in the season, Friday night, this will be full of some, seriously injured people. People with broken bones, and they're not sick. You guys know sick, not sick? So they're not sick. They won't be here if they're sick, but they're not well.
Where's the nearest hospital?
Issaquah.
How far is that?
Good weather, 30 minutes, yeah, down the hill.
So how would that work? Let's say that she got injured up on the hill, you responded, you have the sled,
Yeah.
and you're on scene and you are trying to make that assessment. Is she sick? Is she not sick? Can she go to the aid room? We're going directly to the parking lot. What are you thinking about and how are you making that decision?
So, if a patient is sick, so the person on comms, so the person that's running the radios, they're keeping track of everything, they will, if I get to a patient, the first thing we do with the patient is we say, you know, sick or not sick. And we call it radio. Basically, I'll get to the patient and be like, base, this is Matty P. I am at the bottom of Gold Nugget. I am with a 35-year-old male, sick. Need additional patrollers, backboard, O2, call ALS. And that's all I need to say if they're sick. So they start the chain, right? The chain of survival. So like, starts the chain, then maybe, you know, it's gonna be 20 minutes, 30 minutes before the paramedics get here. But in the meantime, Snoqualmie Fire Station can get here. So BLS can be here. By the time, you know, BLS is really close, so we get them in a sled, go right down, bypass the first aid room, right down there. I'll walk you down there if it's not raining. But you guys, when you walked up, we ski the people right down there, right to the parking lot. So literally, the sled is on the gravel, or snow if there's snow, and we lift the patient up, onto the stretcher, in the ambulance, go. So, it depends on the severity, but
And is the fire station ambulance bringing them to Issaquah, or is it bringing them to the ALS ambulance so they get?
yes.
Okay.
So either, right, whatever, so if ALS, so if it's a busy day and there are car accidents going on and ALS maybe can't even like get up here, or who knows. But all the transfers can be done in various locations. You know,
So that sounds like if it was really bad, you showed up on scene, you could ostensibly have them in the BLS ambulance driving away within 5-10 minutes of the injury.
if possible, yeah, under 10, maybe 15. It's amazing
Pretty
how
good
time
response.
flies when, just to get a patient, just to assess what's going on with a patient when you're in the snow, it takes time. And not that it takes a lot of time, but it's way harder than like being in a ED or being in here. Like, they're wet and they're cold and it's snowing or it's foggy and, you know, you have gloves on and your ski boots and you have to pop your skis off and you get to the patient and you're like, oh, okay, this is like serious, you know, like blah blah blah. I'm here. Maybe I'm just there. We still need like 2 more patrollers to bring a sled down, and that takes time. And then to package the patient, it takes a couple minutes. We can be fast, but we're not superhuman, right? So, and then just the skiing down can take a couple minutes. You can't like race down. You have a person in the back of a sled. So, yeah.
What if the pass is closed? How do you?
I'm sure that Joyce has a story about that. I don't know.
It's usually closed east of here, right?
They close it both
Sometimes
sides.
it's closed west.
I do know that they will take a little caravan, like the state patrol will take a caravan of people, like, with them. And I'm sure they would do that for a medical emergency. I'm sure they would do that.
So is it usually like person versus snow, or is it a lot of person versus person, or person versus tree?
Yeah, it's
or
person
like,
versus object sometimes.
Yeah.
But I would say, I don't have the statistics to back this up. This is just anecdotal from my experience. It's mostly just a person falling into the snow or ice. Right. I think that most of the injuries.
How much do people get cut by their own gear? Is that
Yeah, I mean, I see it every season. Yeah, it's amazing. Like
so? The guy with like the cut in his leg, that was
His own
his
skis.
stuff,
Oh, dang.
his own skis, but it happens. People kind of collide, and that happens as well. But and he said he didn't even understand how it happened. He was like skiing and all, and then fell, and all of a sudden he was like, my leg's wet, and it's
Oh,
like
gosh.
you know the skis are so sharp,
Yeah.
you don't even feel it. It's like just like a sharp knife, right? You won't feel the cut, but all of a sudden you're wet, and you're like, oh, my Turk's pants are
Yeah, right.
ripped.
I can't believe he skied down. That's
He skied right to me.
How about concussions?
Yeah, that happens a lot. We see concussions.
Mm-hmm.
Yeah, what's on a backboard if you guys want?
Yeah, we can get the backboard out. What's your protocol for, so if somebody has a head injury, do they
Yeah.
automatically get a ride in the sled, or is it?
So yeah, so that's a good question for head injuries. So there has to be a mechanism, and you know, you guys are A&O, like alert and oriented, so we're level of consciousness. So you gotta know like where they are, who they are, what they've been doing. So you know what day it is. Intoxication, like the drug thing. So also like no, you know, impairments due to drugs or alcohol, to try and clear them, so to speak. Not that we can clear C-spines, maybe I'm getting ahead of myself, but if I see a patient that had a mechanism of injury and they have pain on palp, so pain on palpation, like, you know, it's anywhere from like C1 to C5, and then probably like upper thoracic. Right. So actually, I push pretty hard. I don't know if you guys like how much hands-on patients you guys have had, but like to give you an idea, like when I'm palpating someone, you know, I'll just quickly kind of give you an idea of like the pressure. Right. It's like almost uncomfortable, right?
Yeah.
In fact, sometimes I'll do everyone's real quick. I don't know if you guys. So like oftentimes, like especially kids, I have to pull back a little bit, but like I'm really like in there. So on a back.
So these are, what bags are these, Matt?
It's called our backboard bag,
Okay.
our head bag. So I'll show you what's in here. So pain on palp, mechanism, those two things alone, that's like, it's gonna be backboard. But we're gonna make sure we pad the backboard really well. This is in this kit because we actually use this to immobilize the pelvis. So a sheet, a regular like bed sheet, does a really good job.
Has anybody seen that before? Anybody? Yeah.
You can
do that
too.
as well.
So, but this is the stuff that you really need for mobilizing a person C-spine. You need straps. C-collar is nice, but you don't need it. Something to stabilize their head. So you actually go put these between their head. Wipe the backboard down sometimes because of all the snow. It's easier for the patient not sliding around. Some tape, and this is also a nifty little mechanism that kind of takes the place of this. I like these better because they're just nicer for the patient and they actually work better. So we can actually strap some of that. Want to grab one of the backboards? So you want to pad the backboard. So hey, come on over. You guys can get hands on. You guys can do this. Yeah, we can do pelvis. We'll do that. First of all, I put a pad. See the yellow pad that's down? And it was yellow on yellow, but so just even a little bit of padding is insulation. Number one, like it's cold out there. Yeah, and then number two, it's just more comfortable. There's a movement in the medical community to kind of go away from backboarding, especially backboarding patients for too long, and especially backboarding without any support. So we'll pad underneath the legs really well, and with whatever we have, we usually have blankets. So we could use a blanket and pad. There you go, guys. Right? But if we were out in the field, we'd always have like in our toboggans, we have a couple of blankets.
No pillows.
No pillows. But we can do that now for her. We can do that for her now.
Teddy bears.
Put it under my
Yeah,
knees
so you
if you're
can't,
gonna do
you
it.
should,
Don't
you
put it on
guys
my
could,
Where
like
was
one
it?
person could like pick up her legs, another person could slide the toe underneath and kind of act like she's actually immobilized.
I'll leave this rolled up. We'll use these instead. So, cool. Let's get a person on the head. Who wants to be on the head? So what I would do, you don't have gloves on, of course. I'd be right down here, and I just watch out for her ears, right? Because I don't want to like block her hearing. But see how my fingers like over her ears, and right above her eyebrows. And I would kind of get in here just like that, and then bam. What can you say about the pressure of my hands?
That's there, but it's not that much.
Right. So it's kind of almost like a reminder to the patient. And then I'm the means of communication. So like, hey, I'm Matty P with Ski Patrol. I'm gonna be talking to you. All right. You don't have to shake your head yes or no because I can hear you. All right. I always say that, like, you know, don't move your head, okay? They're like, okay. You know? So that's what you're gonna do right here, okay? You're the communication. Just make sure that she knows that you're the person that she's gonna communicate with.
Alright.
You're sort of like their companion. You're there to help them. You're kind of reassuring them. You're telling them what's going on. So you're gonna kind of talk to her gently and softly and tell her what's going on the whole time, okay?
Alright.
Cool.
And this is even for an entirely unconscious patient. Whoever's
Yeah.
on the head is always talking to the patient as if they were awake.
Yeah, that's really interesting. That's important.
You'd be surprised
So
how
people over
many
here?
seemingly unconscious people remember their
Right there?
entire
All right.
course.
Cool, okay. And then, you guys? Alright. Here you go.
You want it?
Cool, okay. So, you take the tape off. And now what we're going to do is, when we backboard someone, first you're going to put the straps on, and we go from the torso down, okay? And we don't tighten anything, we lay them out, and we're going to cross the torso, we're going to cross the hips, and then cross the legs. So we have 6 of them. And we want to start high, and then go underneath, and you have to kind of communicate with your partner. Let's see, the first one will probably be right.
And we got 10 people here. You're good to go.
So,
Let me know when you leave.
see where I went? Right there? So you're going to communicate that with your partner over there, and then you just do this. And I'm just going to put it over there, and then it's going to be your job. Oops, sorry.
To go to the bottom one or the top?
So you're going to take this piece here, and then probably go right there, right through there. So you're going to put yours
The same level?
same level, yeah. You might have to, just because of your height and this backboard, we'll make it work for now, but.
Good things to
Don't
know.
get hurt.
Yeah.
Yeah. Actually, I changed my mind.
We want to use it.
Can you shuffle up? Let's shuffle up more. There you go, right there. There you go. Okay. I'm gonna go to the very top. Okay, so you put this in
I
here.
don't
Very
get
top.
hurt at Snoqualmie because the back
That should be on your like search for places to ski.
Okay, and then you guys can kind of figure out where you want to be along the hips. So you each have to communicate with each other. So you have one, right?
Yeah.
And so you got to figure out like, okay, we
Well, no.
really want to be like crossing over here.
Yeah.
Okay.
Oh, okay.
So you're going to be crossing this way, across the chest, and we're probably going to go right to here, right there.
So that should be, I guess, lower.
Yeah, so like you're going to start maybe one right up here, right there, and it's going to go across like this right here. Okay? And then you just have to make sure that they're starting on the same side. Yeah, so you don't tighten all the way, but what you'll do is,
Because I figured you were going to
just, yeah, so if you don't want to move her yet, oops.
Should I have my arms under?
No, you have your arms up. We're actually going to have your arms kind of flop around for a while.
Okay. Wait, you already. That's for that?
That's for that.
Okay.
Yeah.
Here you go for this.
So then I should.
And you can tell her what's going
Oh,
on.
yeah.
We're strapping you to the board.
Strapping you to a board.
Strapping you to the
Good,
board.
Why?
And then you
We're
kind of get
trying
this
to get you
way.
down and mounted safely.
All for good reason.
Don't worry about it. Just sit back and relax.
My back hurts.
Go to a chiropractor.
And so you get the other one there, maybe two across her waist, they should cross, and then two at the end. So if you want to do her legs, her bottom of her legs, you can get the hips.
Oh, wait, keep
So,
this one.
so you go across her back. So there's a short one.
So the one across her legs should go where?
Sometimes I just do like one across the thighs and then one down around like near the ankles. Like
Let's go this way.
Yeah, so you need one for
This way.
Yeah, crossing right here.
Yep. So like maybe from here to over there,
Gotcha.
from
And then
here to over
okay.
there.
So you have the long, I have a long piece.
Oh, here, wanna try it?
Yeah.
And Mustafa, can we put one cut just straight across the
straight
both
across,
sides? Yeah.
Do you wanna grab the adult seat collar over there?
And I can start the one version.
The bigger one? And then just walk around over here. We'll put that on.
So I'm gonna open this up.
Yeah. Okay. And then this is where it helps have another person, right?
I don't volunteer.
She's lying down, right? So I want to make sure that I can actually get it. She's gonna be laying down, so I'm gonna slide it behind her neck like that, and wrap it around
Yeah, exactly.
like that.
So I did the whole kind of sequence of doing that first.
Remember, this may be a person holding her head, right?
Right.
And
I
so
found a way to use my EMT because you have to get state certified. When you go through
If you have people that have different,
you don't get somebody to sponsor you.
This is kind of like a
government organization or a state level organization, and you can't actually provide care.
yeah, so
So the manager.
and you're gonna hold her up a little bit. There you go. Yep. Try to put a little more so you can see if possible. And this is with the head, you gotta really work to keep her head still.
Be really gentle. You don't want to end up
it focus here.
tweaking the neck any more than you need to.
So it's gonna be tighter, yeah. So
Yeah.
for her, watch her hair. There you go. There you go. How's that? So, okay. I might even like tape this. Might roll this up and tape it on there.
Yeah.
But it's not supposed to be comfortable. It's just supposed to remind the patient to like keep their head still, and it prevents like too much movement. Then we take those towels at the end too. We'll use those at the end. But now, so the head would still, you still hold her head. And now we're actually not going to lock her head down as the last thing. What you do is you go from torso to hips to legs, and then we'll tighten in that order. Okay, so that's okay if you tighten it already. So, and we're going to ask the patient to, and we'll do this like in tandem. So, and so if we can, we don't want to like tug on the patient. But we're going to ask the, what's your name again?
Stephanie.
Stephanie, take a big breath in. Now tighten. Okay. Swing out.
So why do you think he did that? Why did he tighten while they had a deep breath? Holding a deep breath.
To be able to get it as tight as
You
possible.
guys can go down here.
Yeah,
So
and
you-
also if you tighten it when they're exhaling, right, they're not going to be able to
Yeah.
breathe as well. So you want to make sure they have the maximum
Right,
maximum
right.
ventilatory
Yeah.
capacity. Yeah.
we try to tighten like we try to tighten with two hands. So you're pulling this
Dr. Lux would be
at the
proud.
same time. So when I say what I'm doing, so we're not jerking the patient around. So I'm pulling with this hand in and I'm pulling that hand. So we're not moving the patient around. And then we would probably get that flatter because we don't want to pinch in her thighs, but that's okay. For now, it's okay.
Yeah, enough for government work.
Good enough. GMO, is it good enough move on? Sometimes you have to do that in the field. Okay, the last thing we do is take those two things.
Alright.
Okay, and then we put them here, and then we tape that down. So we tape this right to the backboard. And right over her forehead, and then we'll tape over her chin. Right, so right here in the chin we tape, and right over the forehead we'll tape. And I sometimes do like the backwards like tape. I take a piece of tape and I flip it, so I'm not like actually sticking it to her forehead, and I don't want to get her eyebrows and give her a free like eyebrow wax. Sure.
Yeah, why not? Go for it.
Alright.
We already have everything else done. Might as well do the tape.
And this is where it helps to have people on the side too, because you can lift the backboard slightly while I do this. So why don't you'll still be on the head actually. Keep holding the head. We'll switch the spots. And then if you guys could just like lift up underneath here when I say, just like lift up an inch or two. Okay. Now you lift.
So if it's a guy with like a pretty manly beard.
Yeah, well it's going over the beard.
With a pretty manly beard.
Couldn't think of anything else.
And I probably do that a couple of times. And then what I meant by the close. And if we were in a rush, I wouldn't do this, but time. Like if someone's still, getting the sled is still getting ready. You still be holding her head because I could jostle her around and look up again.
Yeah, one job.
Yeah, it's kind of boring. And so I might take that down a little harder, but can you feel that?
Yeah.
Yeah, there and there.
Yeah, no, I really can.
Yeah, and I'd probably tape it down a little. After I get the first tape down, I'd tape it again. And then that's it. And then what would we do? What's the last thing you think we do before we transport?
Just check
Check in with her.
Check what?
that she's
See if
can't
she's
move.
tight or
Mental
can't
status.
move.
Sure, we're always checking mental status, I guess. I might tape her thumbs too. Okay.
So what are the types of patients that you're immobilizing? Anyone that you're bringing down on this thing?
It just keeps her hands together. And then I'll also...
Wait,
So
is that
she-
a joke or is that being serious?
No, I'm serious.
Because otherwise their arms are
Yeah.
They're flapping around.
dangling off the side of the boards.
Yeah,
They keep
and I'll
going.
probably tape her feet together. And, it's, sometimes I'll, if we have more time, I'll sling the swath. I'll sling and swath both arms so they can't fall out. We can practice some sling and swaths. But we want to check her CMS, right? So I've already checked her CMS before, so we've backboarded her. And before we transport, I'm like, okay, can you squeeze my hand? Great, okay. Put some circulation in your fingers, good. I'll tap her feet. We okay? All right. Let's go. So, like back in the day, even like not back in the day, a couple of years ago, they wouldn't pattern very well. And what they were finding, correct me if I'm wrong, Miles, but people's secondary injuries were just from like being on the backboard and starting to bruise easily because you can't move, right? And if you don't have proper padding, it's not good for anyone. Just like lying on a stiff, hard board for hours. Because if you get to the hospital, all of a sudden you're not number one anymore. You were number one here, but you get to the hospital and you're like, yeah, you're fifth down the line. We have people that are more seriously injured than you, and then you're going to stay on that backboard for a while. And they were finding like other secondary injuries, leg injuries, lower leg injuries, knees and tib fibs and ankles. This is fun. Who hasn't been teaching yet? This is an easy one.
Okay, that was easy.
All right, Alice, here, have a seat. Anyway, whatever you want. For the photographer, whatever's easy. So, do you want to do that same thing where you go like this? And, okay. So, on three, you're gonna lift her leg. 1, 2, 3. Okay, put her down. Okay, so what happens here is called the DJ. You can let go.
What's it called, DJ?
I have no idea, but it's called the DJ.
That's cool. I like it.
And so it's adjustable. So let's say you're probably not comfortable like that, right? There's your knee. Okay. So pull up on her knee like that, and then we can raise this up.
So
Okay.
fancy.
I need a
It's
DJ.
pretty smooth.
Oh yeah.
So see what happens? Like it actually raises from underneath, right? So this is adjustable. And then what we'll do is we'll strap this down, like so, okay? And we don't want to get fancy, we can like cross them. But basically it's a highly adjustable and very quick splint. And you can imagine like anything here to like above the knee, right above the knee. It doesn't matter to us, it's all the same. Let's splint it and then put it on a toboggan and go down.
Yeah.
Right? So it's pretty quick and fast and also pretty comfortable. It's insulated. And it's nice and solid, like, can't really knock it around too much. DJ.
Is it heavy?
How cold are people usually by the time they make it down?
They were cold. By the time we get to them, the injury's already happened. It's been a couple of minutes or more. They're wet. It's snowing or raining. They're in the snow. We deal with like mild hypothermia often. So that's why we have the hot water bottles. We used to have a blanket warmer over here. but it broke. But we like warm blankets are like, oh, it's so nice. So this is a DJ. And one of these tarps, 2 wool blankets, and that pad will always be in a toboggan. And so that's actually, besides the O2 kit and the doctor's quarters in there, I'll show you kind of what we have in a toboggan, like a kit that we carry in a toboggan. And I'll show you my pack too, kind of personally, what I keep on me as a patroller. There's a couple different patrollers that run toboggans, like you can be blue certified or black diamond certified. It takes a long time, it takes like 8 weeks, like 8 weekends.
Wow, that is a lot of
You
training.
have to do it consecutively. So I'm comfortable with this. Yeah.
Yeah.
There you go.
Put me on the catalog.
And you got some straps here.
That's pretty light.
How heavy do you think that is?
I would say 30.
Yeah, it's not light. So you can, if you can feel it, see how heavy it is. So, you know, sometimes we have to like, I'll have to ski down to an incident with my pack and that.
And
So I
yeah.
have like a pack in my front and a pack in my like, O2 in the back. I'm like,
Like that?
no, I mean like my actual, I'll show you my pack.
Oh, okay.
Like,
So you ride that in the front?
In the front, yeah.
How much is it?
Enough to go for a good like 10 or 15 minutes if it's full, if it's not full. Go full throttle, like 25 liters a minute, which hopefully it won't be. So this is like one of this is also our trauma. It's kind of a trauma kit. So it's our O2/trauma kit. You guys come on in. You can go on that side too if you want. So this is a traction device for a femur, and you guys are seeing something like this. It's tiny, but
We can put that on later too. If
can totally put this on later. Yeah,
It's pretty cool if you
it's
have
pretty
seen it.
cool. So it's good for like, you know, the quick and dirty. It works pretty well. So we have nasal cannulas, always stethoscope. I have my own stethoscope on me. You should have blood pressure cuff for an adult, one for a child. Yep, so adult and child. Stethoscope, suction devices, which are nearly useless. I find these to be like not very effective.
What are you supposed to be used? Yeah.
If there's any vomit, right? So, well, when you're doing CPR on a patient, you don't vomit. So, and it gets pretty nasty. It gets all over the place, and like you just gotta keep the airway like that big. So,
Or like any facial trauma, you have broken teeth,
Yeah,
a lot of
blood.
bleeding in the airway, so you
Yeah.
gotta like constantly be suctioning through
Yeah.
the airway.
but that's like a soft tip. So. For the BV, non-rebreathers, BVMs should have a child and an adult. BVM.
What's BVM?
Oh, sorry, bag valve mask. So you've probably seen these like so you can also make it into like a child, or if you didn't have this one, that one, the small one, you know, you can just collapse it, and then the volume of air is less, right? So it's you know, EMTs have to improvise, right? So, you know, airway, right? We have stuff, like, think about this, like, this is all for the airway, right? Like, all this stuff right here, all airway. So, the O2 tank,
What kinds of stuff do you find that you need the O2 for?
any trauma, so any sick patient, so, any patient, right, that is going to have ALS or BLS even, we're going to use O2. I can't think of many things that we're not. So yeah, O2 is one of the things we can give people, and almost every patient should get O2. So SEM splint, you've probably seen these. Your own, so every patroller has their own, but in case you need one, right, sometimes yours can get like a lot of blood on it, or vomit if you're doing CPR. So like I've gone through like 2 of these like while doing CPR, just because like there's my vomit. It's like not effective anymore. I can't, like, it's sliding around the face. Keep the airway open. Right? I've only used one once, but you guys probably all seen these, right? The OPA. Maybe you've seen it. I don't know.
No.
I don't have a dummy up here. Put it in. I'm sure our gag reflexes would not allow us to bring it in, but it's to keep the airway open and the tongue out of the way, so the tongue doesn't fall back. And you put it in the patient, and like, as you put it in, you turn so that you're keeping the tongue out of the way from falling back, blocking the airway. And you size it up by going from like bottom of the ear to right there, the mouth. So that would be right for you. It's perfect. I'm kind of judged by looking at the person usually. I'll be like that one too. This one. So keep the airway open. That's important. And then there's gloves and all kind of other stuff in here. Paperwork, but masks. Tons of like big like bleeders. So you have a bleeder. Right, heat bags, paperwork, some padding. You guys have any questions? Let's say like this is the mid-shaft femur fracture. We can. This is only good for that. Okay, so this is only good for a mid-shaft femur fracture. And in order to pinpoint that in the field, like sometimes like we just don't know. You know, the patient's like, it hurts really bad, like right there, and you're like where? Like, right there. I'm like, okay, you know, and like both their feet look about the same, and like there's nothing funny, like it's not presenting like that or short, you know, because sometimes like a present like a little shorter or like angulated, and sometimes they're like right there, but sometimes it's higher. And we've actually like, you know, we don't diagnose, but we're like, okay, we think it's like pelvis, you know, and it'd be like, you know, top of the femur, or we think it's like, you know, a knee, but it actually is like bottom of the femur. So you're like, oh, I don't know where it is, but so if you know it's like mid-shaft, right there. So we measure, and it's definitely too long. So we measure on the good side, and we want to go past, I don't know, what? Let's not forget.
8 to 12 inches.
Yeah, so if that's too long, right? So if I'm going from like, right there, so we can go from the pelvis right there. So from the pelvis to like the bottom of the foot, we want about this black sticking out. So that's too long. Why do you guys think that would be too long? Like after we splint his leg, where is he gonna go? So we splint his leg. He has to fit in the toboggan. We have to make this fit in the toboggan, right? Or on a backboard. He has to be backboarded or be put in the toboggan. So this can't be sticking right way out. So I'm gonna fold this up again and say what's nice about this is it's collapsible, right? So I fold that up again. And another neat thing is, see this up here? So it's actually. I can do this right. Which way?
Yeah, and while Matt's doing that, we had a good question over here. So, why are we pulling traction on this? Right? Has anybody seen a fractured femur before? Right, so you definitely have that foreshortened extremity, right? Because the bone ends, right? The quad's so strong that it'll pull the bone ends together. And so this, right? We have a ton of bleeding in there, and with those bone ends moving around and lacerating arteries or veins or more muscle tissue, you want to pull the traction and keep it in line, right? So this is kind of the definitive treatment for that sort of injury. And you'll notice, like, I mean, Matty's done this countless times, but when you pull traction, like their pain goes from like an 8 to like a 4 or a 3. Like it significantly drops.
And they're in pain. Like this is something like the person's gonna be in the most pain they probably felt. Like they'll be screaming, like swearing. Although there's one guy, I wasn't able to work on him, but like the patrol said, like they were so calm. They didn't understand like why the person wasn't like going nuts. Because we always get like the information back from the hospital what was wrong, and they're like, oh yeah, it was like mid-shaft femur break. The guy didn't even make a peep. So some people are just like, yeah, I'm hurt. Like, no, I can't stand up. That's one of my good friends back in Vermont, like he said the tree appeared out of nowhere, and he broke his mid-shaft femur. He said he was like in the glades. He's like, yeah, man. It's like I was snowboarding, and all of a sudden there's a tree. I don't know what happened. And he said like he saw the tree, and then didn't have a chance to slow down or anything. He was like, boom, and he like hit it so hard it knocked him out unconscious. And when he got up, he didn't know if it was a couple of seconds or a minute, but he said he got up. And he kind of stood up, like sat up in the snow, and he said that he wasn't really sure what happened, but he didn't feel, he had so much adrenaline, his body was like doing whatever. He said, "Am I okay?" And he was by himself, and he said as soon as he tried to stand, he knew something was wrong, but he actually tried to stand up, and as soon as he tried to stand up, he felt it like go like this, the bone, and he said he like screamed in so much pain, and he passed out and fell over. And then he like woke back up, and he was like, okay, this time I'm gonna crawl. And he like crawled out of the glades to like wave someone down that was skiing by.
Oh my god.
So it's like, yeah, most people, this is gonna be the most painful thing they've ever experienced. Have you ever broken a femur?
Do people get hurt off piste here, or is there a lot of off piste to find? Or-
Not really. But tree wells we deal with, and like these weird moats at the little streams. People will be skiing in the trees, and all of a sudden they're like 10, not exaggerating, like 10 feet down, in like a little creek that they just didn't see. It's like a little dip, and the people like get hurt, like break their ankles, or just get stuck, and they actually can't get out. And they're like in a little puddle stream. But yeah, we deal with tree wells every season.
Well, at least one person dies every year in Washington State on average in tree wells, right? So
This year was
it's a good lesson.
Alpenpol. Last year I was the second patroller on scene here at Silver Fir. So that was a tree well incident where, yeah, and like I have never heard of a tree well incident working out in their favor. Like I only know like subjects, you know.
So is everybody familiar with what the concept is of falling in a tree well?
Yeah.
Right, so they're skiing deep powder, right? It packs really well on the snowpack, but right around the base of the tree where all the boughs are overhanging, it doesn't pack very well. So if you fall and tumble into the tree, you can end up upside down in this really loose, unconsolidated snow. And then you're upside down, you know, in this tree well, in this hole around the side of the tree. And then you have your snowboard or your skis on, you can't get your bindings off because you're upside down, it's all snow. And people just end up suffocating because
Yeah.
they can't, they're just kind of stuck upside down in this powder right around the tree well.
Yeah.
And it sounds pretty benign, but it's pretty serious. And
It's
that's
a serious
why.
thing. We actually have signs, and maybe we have some in the back during the big powder days in the beginning of the season in December. Like it's like tree well, like we're trying to warn everyone, like ski with a buddy,
Together.
make sure you can see each other, like make a couple turns, stop, look, make sure your partner's there.
And this is inbound, so this
Inbounds.
is not like out of bounds in some crazy area. This could be like right up here in the trees.
It was underneath it was basically underneath the Silver Fir chair, like off in the trees. You know, at that time, you know, like my fiance at the time, wife now, could like see me over in the trees and other patrollers like doing CPR on this guy while riding the chair. So it's pretty wild.
A lot of people don't even know that hazard. So.
Yeah. So anyways, yeah, doing CPR is not fun, but we practice a lot with the dummies, and it's a good thing. So, okay, so femur, mid shaft, like he's in a lot of pain. You probably get one or two people to actually start pulling traction. If we have everything set up, we know we can keep traction, then we'll have someone actually pull traction. But really, you don't want to be yanking on them if you're just going to let go. Because then you're just doing this, right? And it's like further injury. So we don't have to do this right now, but someone would kind of come here and let me know if it actually hurts, okay? But I would get like a good grip, and this is where it really gets tiring. And I would just kind of go like this, and like my body weight. Can you feel that?
Yeah, it could be hard. You could do it a little harder.
So, but I would really, I would pull it. Yeah, someone might actually be holding them. But so what we're gonna do is we're gonna put this cool little strap on their feet. Okay, so we'd have his boots off, most likely. We really want the boot off, and this is gonna go around his foot, and then we're gonna put the strap up like in his crotch. You want to take that off. It's so.
And so with that upper strap, maybe I'd beat next to it, but we always say think like thong,
Yeah.
not granny panty, right? So you really want it angled up as
Okay,
high
yeah.
as possible.
It's gonna pinch, so
Gotcha.
just move
Kind
the
of move stuff. to
yeah,
the
move
side.
stuff.
Thank me later.
Yeah. And you know that's one of those things. Even like in the emergent, like you know during the emergency, so to speak, you're gonna be like you want to pay attention to that. You don't want to like hurt someone, guys or girls, right? There's stuff there. So the padding is gonna go like right here around the ankle. I'll just roll this up to make it easier, okay? And so this strap, I'm gonna strap it right around the ankle here. And this Velcro's strong, like thick. See this thick Velcro?
Yeah.
Like this stuff is really strong. Like to try and tear it off. So it goes there, and then let's see this right here. We're gonna kind of get that nice and tight too, all snug. Okay, where's this guy here? This is the green, yellow, red. I haven't done one of these this season yet. This is good. That's the green one. Okay.
Yeah, do these colors mean something? Or is it just
Yeah, it's color coordinated for a reason. Yeah, I'll chat about that. Okay. So, which one is that? That's the bigger one. Okay. So, top strap. All right. We're gonna get all in his business. Okay, and I'll kind of go like this. I'll slide it up. Like,
Yeah.
okay, that's good. I don't want that buckle though. Like, I try to get the buckle on the outside.
Oh, yeah. That's good.
That makes sense?
Yeah.
And remember, I just asked him to get all the stuff out of his pocket. So I'd like physically take it out of his pocket and like just stuff it in my pocket if I was with the patient. So this is gonna be nice and tight, and this is gonna go. And I'm just gonna push up there. You feel that?
Yeah.
Okay.
Nice.
Cool. So I think I got the right length. I hope. All right. Now we got around his ankle, nice and tight. See what Miles did?
So it's always green first, then yellow,
Yep.
then red. Kind of like
So-
a traffic light.
Remember, before I ever put this on, I strapped down right here underneath the arch of his foot, nice and tight, and then yellow is next. So that's the last thing we'll do. And so this is where we can actually pull the traction. So I might even have to hold his hips down. Go ahead, Miles. Keep pulling until you feel it uncomfortable. Well, before it's uncomfortable. See what's happening? It's pushing that up, and it's pulling his leg down. Is that okay? Can you feel it?
Yeah.
Yeah? Okay. So next, we gotta like kind of stabilize the rest. These straps here, we're just gonna go above and below the knee. Okay, we'll make this as clean as. I put this on backwards. See? Whoops. So I'll improvise. How do we do this? This way. And then this one's going to go up here. And I would have put this down probably earlier on. Okay. And can you feel that? Look at your toes for me. Okay, good CMS, I don't know. Against pupils.
So for this, if you were worried about temperature,
Yep,
right, you
right
could
there.
just cut off the top of the socks. So you could expose the toes.
Can I? I mean, they'd be really good in the film, right? How much are these socks? So that's a good point, actually, because we do want CMS. And I'd probably just go like this, go snip.
But notice Matt's really good about checking the CSM before and after, right? Because we want to know, like, if we didn't check CSM before and then we pulled traction and then we checked CSM, right, and he had no circulation, we want to know, did our splint
work?
cause that, or
Yeah.
did he already not have circulation before we put the splint on, right? So
And then
always check before and after any treatment.
yeah. And then I just tucked that away. All right.
Looks like it belongs on a fire.
Yeah. It's pretty burly, and it's honestly they're kind of uncomfortable. Look at this thing.
Yeah, which one would you rather carry?
So like the patient's like hip like kind of sits up here on this thing, and it's kind of neat though. You can like put your leg up. It's kind of cool. I think it's so it's comfortable. And there's a ratcheting system.
It does sound cooler.
Yeah. I was standing up in the snow, like this, standing, and he was right here, and I was doing CPR standing up. That's how much like the tree well I was in. Like, it was crazy. Like there was a bench of snow made, and it wasn't like I was doing high quality CPR the best I could, but he was in the snow, so you're losing energy in the compressions, right? Like the snow must be compressing little by little as you're doing CPR. So I was pushing harder and harder as time went on because he was like sinking slowly. And then eventually we got the sled there and doing CPR on him, but we were doing CPR for like, oh God, I don't know, like 25 minutes probably. It felt like eternity. But we had to stop CPR to transport him down the hill. So, because you can't do anything for the patient in the trees there in the snow. So we made a decision at that point. I think it was cleared with like the medical director that was like down here. I think it was a doc down here. I can't recall exactly what happened, but we made the decision to stop. And it was like we knew the ambulance was in the Silver Fir parking lot, at the bottom of the ski hill. So we knew that there was an A-collar waiting. So we stopped.
So did you like put the AED on and not have a shock absorber then?
We didn't get an AED.
Oh.
So the AED was like over in the lodge,
So
and it never got over to us. It would take some time. So we didn't actually use an AED on that patient, but they put an AED on at the bottom, and there was no shock fluid. I think he was dead when we got to him, just from the color, like the color of his skin, and for the amount of time that his friends were doing CPR on him. And I think it was actually the airway too. Like he had a lot of vomit. Like his friends were doing CPR so hard and they were breathing so hard that his stomach had distended, and they're pushing on him, and it caused vomit to come up. And I'm pretty sure that his airway was blocked with vomit when we got to him.
Do you know how long he was in the well for?
It could have been anywhere from like his friends had skied down, waited for him at the bottom for a little bit, taken the chairlift up, skied down to find him. That's when they found him. So it was at least 15 minutes. Like, at least, right? Because they skied down, waited, the chairlift up. Even if they were super fast, probably more like 20, 25 minutes. Little insulation, SAM splint, and then my slings and swaths. So I use these a lot. So it's just a piece of sheet, it's a towel that you take. It's kind of like a triangular bandage but big. And so if you had a shoulder injury or something, or an arm injury or wrist injury, so I go like this, tie a little knot in the end, put it like so. Let's see. Yeah, thanks. It's easier when you have some help. That's kind of good.
Yeah, so these are just like the cravats that he was showing before, but just a little bit more burly, a little bit larger. Could you imagine somebody has a bunch of ski gear on?
Yeah, so like, it's kind of, this one's actually kind of big for her, but might use a smaller one. But just to stabilize like the any arm injury you have or shoulder injury, and then you put another one like across the chest too. So I've read lots of sizes. I picked a big one. That's my ski pack. I'll show you the sled. Don't forget to go around here if you want.
Are you given any medications while you're on the wheel?
Just oxygen.
Oxygen.
Yeah. I'll give the epi, but not here. There's oxygen. It's blocked, I think. So this is a sled that's not ready to go. It's an older one, but they're long, right? So this one's a little narrower and not as high. So this one's not in use anymore. And all the other slides you'll see at the top of the hill, and they're actually like ready to use with the tarp, the 2 blankets, the pad, and that DJ. And they're strapped up, wrapped up, and kind of watertight. And we strap them down right in the center. And that's yeah, they're heavy. And so that's what girls use. And there's some fins on them. keep them going through straight. But yeah, they're all up on the hill on the top, right, ready to be used.
You mentioned that ski patrol gets hurt.
Yeah, some people like tweak their knees or yeah, because it's manhandling that thing, right? These are heavy. You put a patient in it, and then you're going down a steep slope, and then you have one person in the back, one person in the front.
Yeah. So how many? So this is a 2-person job.
It has to be 2-person job.
Okay.
It's a 2-person job.
So somebody in the front with the skis, right? Right, just holding onto that rail, and somebody with a rope tether in the back.
We can actually put someone. So to get down the hill, this would be kind of fun. Last thing. Why don't you guys put your jackets, right? Put your jacket on, and we'll do something fun. We'll put you in the banana boat. And so it's the thing we actually bring like patients down that maybe have like a minor injury, but they can't stand up and walk down the hill. And so we just like this. I'll just walk them down in the banana boat, and we'll go down to like the car where their parents are waiting.
See the banana boat.
To get the bananas.
Nice.
This is so
Yeah, yeah. Like I said, we put a tarp in, and then we cover them up so they stay all nice and warm, and then buckle them up. There you go. Buckle them up, strap them down. Yeah. It's always nice to find out you're in charge, like just in the spur of the moment. Like, hey Matt, you're. Oh, yeah, sure. You're nice and warm already?
Yeah, this is nice. I didn't fall asleep here.
If they had ski goggles and a helmet, I'd probably put it on. Alright, you guys are gonna do the hard work, okay?
Yes.
You might need like 2 people on each rope.
Do you trust us?
You gotta get a video of
You got
this.
my jackets hanging right there?
What's that?
Jacket?
Your jacket?
Yeah. Okay. I'm not going anywhere yet. Thanks, buddy.
I immediately regret it.
So we won't take them down the whole way.
Just like let him go.
Yeah, probably not. Okay, so we're gonna go down this
To
way.
get your first patient.
So what we do is you'll turn towards me. A little closer. And then 2 people have the rope in the back. Now you're actually gonna go behind. We just get them going enough so that, and then you'll help kind of like as they start to go down.
Some other people can get on the rope too, so.
And then kind of let them go.
I'm worried he's gonna end up in the parking lot. This might be the last event.
Basically how you let them go.
For good
You're
reason.
cut off.
Okay, the people in the back, yeah. We'll stop there because it's really hard. If you don't have ski boots on, you slip really easily, so we'll stop there. So really we want like skis on or ski boots on to get purchased in the snow.
So this is a banana boat. Just walk somebody down the
Walk someone down to the parking lot like that.